Hi everybody, welcome back. Today we're going to talk about joint mobilizations for the knee and for the elbow. And today's Rowan representation is Rowan field hockey, baseball hat. And as we talk about the knee, let's take a look at the board. The last few times we talked about a stationary concave surface and a moving convex surface. The knee is the opposite, at least the tibiofemoral joint. So if you take a look at the femoral condyle, that is a stationary convex surface, and the tibial plateau is the moving concave surface. So as the knee extends, gliding has to occur in the same direction of movement. So the tibia will glide anteriorly, so this is a lateral view of the knee. It will glide anteriorly as the knee extends. So to improve knee extension, we therefore have to do an anterior glide, and to improve knee flexion, we would do a posterior glide. If we take a look at the patellofemoral joint, this is an anterior view with the knee flexed, so it's looking at the knee straight on with the knee bent at 90 degrees. You can see the stationary concave surface is the top of the femoral condyles, and the patella is actually the convex surface that is moving. So therefore, with patella mobilizations, we're moving in the opposite direction, as you will see. Looking at the elbow, it's a similar arrangement as the knee. When the elbow is flexing, the radius has to glide anteriorly. We have a stationary convex in the capitellum and a moving concave with the head of the radius. So therefore, as the elbow flexes, the radius has to glide anteriorly, and it glides posteriorly as the elbow extends. So let's talk about how to mobilize these joints. Now, to improve knee flexion, remember the tibia has to glide posteriorly on the femur as the knee flexes. So we have her in the open pack position, which is about 20 degrees to 30 degrees of knee flexion. That's why we do the Lockmans in this position, because it allows the most amount of joint play. So we're going to apply a little bit of traction here, and we're going to apply a posterior force on the tibia, and the femur is fixed. So this is a posterior glide, 2 to 3 glides per second in 20 degrees of knee flexion to improve knee flexion range of motion. Now for anterior glide, we have the bolster underneath the thigh that's just above the patella, and we have the knee bent about 20 to 30 degrees in that open pack position. And I have my leg underneath her distal leg just to keep her in 20 degrees of flexion. And what we're going to do here is maintaining that flexion. Again, anywhere between 20 and 30 is acceptable. We're going to apply an anterior glide this way. Now, if I'm using my thumbs, I want to make sure I'm not digging in with my thumbs. I want to keep them flat. Or an alternative would be to use my whole hand and glide anteriorly this way. Again, we're gliding anteriorly to improve knee extension, range of motion. So for the patellofemoral joint, the open or loose pack position is with the knee in neutral or 0 degrees extension. We need to glide the patella in a superior direction for extension and an inferior direction for flexion. So to do that, we can use the web space of our hand and go ahead and glide that patella in a superior direction. We want to make sure we're not compressing the patella down towards the table, but truly up towards the hip. You could do oscillations like so, or a sustained glide like so. To glide inferiorly, same thing, we're using the web space, and I'm feeling a little bit of crunch, so I want to make sure that I'm not pushing down towards the table. I'm truly pushing down towards her toes as I'm gliding that inferiorly. Again, we can do a sustained or 2 to 3 per second. In some cases, if we need a little bit more force, I can wrap my hand around my wrist and lean into it a little bit more, which I've had to do with a few post-op ACLs and getting aggressive with patellofemoral mobilizations. We also want to have the patient, they can do this themselves post-operatively, make sure we're gliding medially. That's laterally. and gliding medially as well. Tell the patient to move their kneecap north, south, east, and west for 3 to 5 minutes each day to keep that patella mobile after surgery. Now for the elbow, we're going to mobilize the radial head. So to improve elbow extension, the radial head has to glide posteriorly. So I'm going to find the radial head between the thumb and forefinger, and again try to keep the thumb flat so you're not digging into the skin. And we are going to mobilize the radial head posteriorly like so to improve extension, and then lift it up anteriorly for flexion. You'll notice I have a folded up towel underneath. That's just to create a little daylight under the elbow for this glide. Now, because she's a smaller person, I'm just going to use my elbow and fingers to mobilize. But if there's a larger person, I need more force, I'd use my thenar eminence and glide like so for posterior. And I'd still have to lift up anteriorly with my fingers this way. And that's radial capitellar glide for improving flexion and extension range of motion of the elbow. Now our workout from home tip for the day is using a paint can. As you can see, I just got done painting the ceiling, and we're using that can filled with rocks, and we use this for lateral raises or bicep curls, you name it. So next time we're going to talk about core exercises and give you some ideas for rehab for that. I'd like to thank our guest Miranda Christie for being such a great model. See you next time.